All right. Hey everybody, Kate Miller here, resident therapist and education coordinator. I'm here with Justin Johnson. We're going to wait a few minutes for some bodies to show. I thank you all for joining us. I know 1, it's Friday, 2, it's a holiday week, and 3, it's late, whether you're on the West Coast with me over here or the East Coast with Justin. So give us about, 30 seconds to maybe 2 minutes just to let people continue to file in, and we'll get started. I can tell you right now, Justin, it is 116 degrees out.
And, where you guys are?
Yeah. So wow. It's a hot one, that's for sure. I don't think I've ever cranked the AC so much in my life.
It's today it got up to 98 here. But of course with us, the humidity is horrible because the ocean's right there.
Awful.
So 98 is like 500. It feels like it's horrible.
No overestimation whatsoever. 500 degrees.
No, 500. It's hot enough to the point. No lie. I have to. Anytime I have to travel from one facility to another facility to work on people, I literally have a little igloo cooler that I put a couple of those hard ice packs in, and I put my canisters of ointment in them.
Oh, there you go.
Yeah. Otherwise, by the time, just from riding in the back of my SUV, by the time I get there, they'll be melting.
It's pretty much what I'm doing outside. I couldn't believe when I walked outside it said 116. I'm like, you've got to be kidding me. But I like it because it's so.
Yeah, that's the difference is you guys got that dry heat.
Yes, and I love it, but it's not good for newborns, right?
No, and that's the bad thing about it. And then it's the same with us having all the humidity. It clogs up the newborn's, nose and sinus glands and everything. It's horrible.
Hey everybody, we have some more people in. I just want to say hello. Thank you for joining us again. I know it's late on a Friday night. I'm Kate Miller. I'm the resident therapist and education coordinator. I'll say that one more time. I have Justin Johnson here. He is in Florida. I'll let him talk about himself in just a minute. And we're just going to get started. I want to remind everybody that if you hashtag HawkTalk Live, we want to send you a shirt as a way of saying thank you for promoting this webinar. We've been doing it for a little over a month now, and every time it's been super successful, sans last week and then the weather, but both things we couldn't have helped. So I thank you guys for still signing in and listening, and I hope you enjoy the show. Again, HawkTalk Live as seen here. Also, next week, please join us with myself, of course, and Dr. Feinberg. He is very well known in the chiropractic industry and has some really great safer pain relief techniques to talk about. So first, I want to introduce Justin. He's a CSCS. He's a certified personal trainer, or in some states, certified fitness trainer, and also a certified manual therapist. He's done so much for us and so much in his career. I'm really excited to have him on board to talk about his special population, bodybuilders, which is not something you see every day, at least in my practices. So take the floor.
Sure. Again, hello, everyone. My name is Justin Johnson. I'm the owner and head therapist of ROF Performance here in Miami, Florida, where, as Kate was saying, my main clientele is bodybuilders. It kind of got into that field, not really knowing that that's what I was going to get into. Originally, I was like any other practitioner. I was mainly into prehab and rehab work. One day, had a bodybuilder come in, and he had a lot of soft tissue adhesion problems going on, especially in his back. He had been to a couple other people. No one could do anything for it. And I was kind of his last resort. After examining him, going through range of motion, it was pretty easy to see what was causing his pain. It was just a buildup of scar tissue within different muscles. We started going through and treating him, And then along the way, not only our main focus was the range of motion that we were trying to improve, but we noticed something very important to a bodybuilder, and that's that the symmetry of his muscle started coming out more, which for a bodybuilder, whether it's someone in the men's class, a female that's a figure competitor, or women's physique, that's the most important thing to them, is the symmetry of the muscle. They want the right side of the body to look as close to the left side of the body as possible with no flaws. So been able to go through, figure out how to change a few of the techniques, a few of the strokes, if you will, with the tools, and help bring a little bit more of an aesthetic look, along with making sure that they're performing at their best while they're training.
So
as far as the rest, go ahead.
So, and this was this your is this kind of how you got started with the bodybuilders? Was this like one of your first experiences?
Yeah, that was my first experience with a bodybuilder. Actually, prior to that, I specialized with another form of athletes. I specialized with powerlifters and strongman competitors and Highland game athletes. With them, I was doing a lot of shoulder work, a lot of ankle work, and a lot of hip work, because those are the most important things to those three athletes, especially the ankles. My mentor is a gentleman by the name of Donnie Thompson out of South Carolina. He was a very reputable, very well-known powerlifter. He was the first man to total 3,000 pounds in powerlifting. But one of the things that made it even more incredible is how injury-free he stayed during that. One of the ways that he was able to do that is a lot of the performance protocols that not only he came up with, but some that had already been invented and had been put in place by a gentleman by the name of Dick Hartzell from Jump Stretch. Donnie spent a lot of time with Dick, and then from there, Donnie was able to get a job in Columbia, South Carolina, with a PT facility as a PTA, and started picking their brain and learning more and taking Dick's protocols that he had with resistance bands, of all things. Everything Dick was doing with resistance bands was strictly for rehab and prehab. And Donnie just took him to another level. And he made it the primary staple of his training. He actually put more emphasis on the band protocols that he was doing opposed to his actual training at times. When I was out in South Carolina, working alongside him, it was nothing for us to do 45 minutes of prehab work with resistance bands, compression bands, and a few other things before we'd even touch a weight. His big thing is ankles, and his reasoning for that, especially for anyone that's in the strength industry, the ankle is the most loaded joint on the body. It takes more abuse than anything. And if the ankle starts to get messed up, it just starts working its way up the chain. Everything starts getting messed up. The knees, and then the more pressure the knees take, then it goes into the hips, and the lower back, shoulders, neck, so on and so forth. So that really started me looking at a lot of things. Donnie, we found a way, because we worked with a lot of powerlifters. We had to find a way to kind of change our terminology, because a lot of times we would get real clinical with everything, and you could just tell that some of these quote unquote good old boy powerlifters, they would look at us like, what are these guys talking about? I have no clue what that big long word was.
Plus, it's very different.
Yeah, very different. So it's been great, because where I'm at and the field that I work with now, I still use a lot of that terminology that Donnie and I came up with to kind of explain to a lot of these bodybuilders on what's happening and why using iStim is such an important thing and an important staple into their training. One of the main things is of course what a bodybuilder looks for, and why iStim is so important, is as they're training, they're trying to get a pump, and as they get that pump, they're filling that muscle full of blood. Of course, naturally, it's pulling the muscle apart and ripping fibers apart. Well, when the muscle grows, the fibers never go back 100%. Now, that happens with anyone when they train. One of the things that makes it different for bodybuilders is they have to train every angle of every muscle head. So, instead of just doing dumbbell curls one way, they'll go through, one day they may do 4 variations of a dumbbell curl because they have to train every head of that bicep. Well, of course, naturally, as they're doing that, sometimes when those fibers get pulled apart because of the motion in which they're training, it causes those fibers to, as we know, get twisted and tangled. And that's where the adhesions form. The way I explain it is, imagine taking a piece of bubble gum and sticking inside your muscle. And we just got
about it. I mean, really, the literature that we read, and I don't know if many clinicians can jump on board with this, is we always compare adhesions or muscular dysfunction on a structural level as like a spaghetti. Or it's my female athletes is, imagine your hair, there's a snarl in it. You have to, comb out the snarl. So,
exactly.
So tell me something. I know you have a lot of experience with, the power lifters and the bodybuilders. And when we think about bodybuilders, I don't know if anybody has that's watching has experience with this population, but a lot of the injuries seen, correct me if I'm wrong, are cervical, lumbar, knee, and shoulder. But more specifically, I mean, that's very joint related. You have avulsion injuries, you have contusion injuries, you have tendinitis, you have, which I hope you'll touch on later, the subscapularis myofasciitis. I mean, what do you see? First, let's just break down, what do you see as the most popular, for lack of a better word, most common injuries with your bodybuilding population?
One, as you just mentioned, the subscapular issue, that's huge. That's huge, huge, huge. The other one is, I get a lot of people that come to me and they think that they have, of course, they always come, well, I have tennis elbow. And did you play tennis? And they're like, well, no. And I'm like, okay, then it could be something else. Let's break this down. And it's more of
Everybody's, it must be tennis.
Yep, it's tennis elbow. And that's the next one is the golfer's elbow. And the reason why believe it or not, we see it a lot with a lot of the females. And part of the reason why is a lot of, even though when we see photos of them online, the women look huge, giant, but most of them aren't. It's very common for a female physique athlete to be around 5'2", 5'3", and they got very little hands, and everything inside the gym is built for an average sized man's.
Oh, it's so hard. Even some of the kettlebells that my husband has here, my husband's 6'4", and I'm 5'3" at best. And I can tell you that the grip, I wear gloves, specialized design gloves, because it helps with that grip, so I don't get that excess tension on my forearms. But it's this motion, especially with curling at all, it just hits all the way up to the elbow. So.
Yep. And then so it becomes a combination of the elbow, and I get a lot of them that come in and well, I think I have corporal tunnel. And then we go through and where they say, well, I went to such and such and they told me that it's corporal tunnel, they want to do surgery, yada yada yada. So we go through, we start looking at it, we start breaking it down, and then again, that's where the gum analogy comes in. I tell them, no, you got a couple areas where you got something in there just kind of gumming the works up a little bit for you. And especially with the females, a lot of times you can even see it right along the corporal tendon area. You can see inflammation in there, and then go through and start assessing right there on the inner forearm. It'll be just locked up beyond belief. I actually put it
right here, especially, I mean, because the forearm is involved with so many different movements.
So much. Every movement they do, it's all their rotational stuff. If depending on what areas of their body are lagging, they may actually have to be training forearms, and so they're actually doing forearm curls. Exactly. And so that's where, for the longest time, one of the main tools that I used to treat that was just the scanner. Just taking the scanner, and I found a couple extra ways. Exactly, just running it right along that inside, and just you would be amazed at how quickly you'll see that petechiae just boop, come up, and next thing you know, you start having them move, and then once you start breaking that up, going through, and you can actually feel everything within the hand starting to set back in place.
Did you ever use? Now I'm terrible with this, but this is the HG4. Some people call it
Yes.
bottle opener. I've heard it called many, many different things. It's our smallest multi out there for you guys who may not have these tools yet. I find that when, because you're talking about, like the retinaculum and the interosseous membrane and whatnot, that this tool can get right where I need to, especially right along those carpals in between the hand and
exactly. That, and also, and there's a lot of people that don't a lot of people forget that this edge right here is a working edge as well. And just being able to use that right along, right in here, to just start moving some of that inflammation out does wonders. And then breaking up, of course, the webbing right up and through here, just light strokes. And again, this is actually my favorite edge of the tool. I don't know why. I have more success with that edge, especially getting in and just using that. And one of the great things about it with this tool, even though it's the smallest tool, it's another one of those ones that you don't have to put any real pressure to. The tool itself will do its work.
The most versatile. A lot of our hand therapists use it, or the people who work with athletes, because it can get into those target zones that some tools just can't. As much as I absolutely love my scanner, I don't think I could live without it. If I need to get in somewhere small, it's a little bit easier to have the multi. I think one thing that we have to consider, especially with bodybuilders and other athletes, and again, you can correct me if you don't experience this, but skin. The skin is a lot tougher. The tissues are a lot tougher, and tougher is a scientific word, but you might have to use something that's a little bit sharper than your thumb or your wrist or your hands or your forearm or whatever it is that you usually utilize for manual therapy. These things are great for addressing soft tissue dysfunction in people that have either a very, very specific restriction, muscular dysfunction, or have that tough skin. So why don't we go into maybe some treatments that you've done, any specialized techniques that maybe you've done, and then we'll kind of move along into the questions, Q&A.
Okay, that'd be great. So, and one of, talking about tools, and this, since you talked about special treatments, one of my new favorite tools, the Pro, this thing is a game changer for dealing with locked up lats. Between this and the tongue depressor, two of your best tools ever. In the bodybuilding field, one of the things that I find real common is subscapular issues. For a lot of these guys, because as big as they are, I have a client, I'll use him as an example. During his actual training right now, he's walking around right about 300 pounds. And this man is in the single digits body fat. And so the how tough and how dense his muscle is, for me to try getting in with my thumb and releasing that subscapula, I just can't do it. So I found that with the Pro, because of this edge right here, I can basically just hold it like this and just get in there and just work that tool around, right around that subscapula area, while manipulating the arm through a couple natural range of motions, and you'll actually feel it just bloop, let go.
Oh my God.
That's the scientific term, is word bloop. I did look it up. That is, yep. And then, but before I had, for anyone that doesn't have the HG Pro, as long as you have this tool here, you're golden. You're golden.
It's my favorite.
Yep. If you use the smooth round edge, place that right into that subscapular area. Again, finger right on the back, and you can actually, and if you even put just a touch of ointment right across there, you can actually glide that around that subscap area while manipulating the arm, and you're golden.
Especially for somebody, the bodybuilding clientele can be very muscular, and so the eye stim is beneficial, of course, across the board for what we've talked about in many, many other lectures. Why eye stim is beneficial, restoring range of motion, muscular tension, force, that whatnot. But for us clinicians, I mean, I wouldn't call me tiny, but I have really small hands. And when I was working on some of my professional athletes, NFL population, it's really hard for my little hands to get into some of these areas. And I tell you, I mean, you can make little, grown men cry with this thing taken into their subscapularis, but it makes a difference, especially if you add movement with mobilization in there, pin, stretch, a lot of the other techniques that you learn in some of these classes.
Yeah. And it was earlier today when you say that one more time.
Keep talking the way you were talking about your treatments. I'm going to bring up the pictures right now so they have a visual.
For sure. Great. And again, also for now that the scanner and also using the HG Pro. On the photo that we have up now is me using the tongue depressor. And this is a client. He was a couple weeks out from a show, and we noticed that when he was training, that one pec wasn't firing. And of course, being a couple weeks out from a show, you can see he's very, very lean. He's very vascular, and the skin is getting very thin at that point. The way that they dry out, their skin gets as thin as paper. And that's another reason why I love the tools like the tongue depressor and all the other hot grip tools, because the tool does the work for me. I'm barely applying any pressure to him, and we're going through and just following the chest and breaking up the adhesions to allow that chest to sit there the way that it needs to. And to help bring out the striations. That's one of the very important things is while they're on stage, they need symmetry and they need striations in the muscle. They have to have a very, as they call it, a very grainy look to them.
Well, I can imagine that thin is not the word I'm looking for, but that cut.
Cut, yeah.
That proper bodybuilding language, cut.
Cut, it is actually, that's one of those, cut and shredded.
If they're up, shredded. That's what my husband says he is. You can see any kind of dysfunction, not only when they're in motion, but just standing there. I'll move to another picture. Yeah.
Handlebar getting in, and matter of fact, we were talking about subscap issues. This gentleman here, he's in that photo. He's walking around at about 318, and he's only about 6'3". I mean, you can tell his deltoids are as big as my head. And that's the one that I can't, with my thumb, I cannot manually release his subscap. But his subscapula had gotten so locked up and was causing him to track so improperly on things such as a single arm cable row, even his single arm dumbbell rows, that the way it was throwing everything in his upper back off. And again, because of the perfect weight of something like that medium handle, I barely had to apply any pressure, and we were able to get in there and loosen everything up. And most importantly, break up that quote unquote gummy tissue that's restricting those muscle fibers. And most importantly, for a bodybuilder, not allowing the proper blood flow to come in so that their muscles can grow the way that they need them to.
Well, and one big thing, scapular dyskinesia, a lot of what, I mean, which is a very blanket term for some shoulder dysfunction that I've heard doctors hand out, but scapular dyskinesia can be caused largely by subscap dysfunction or adhesions, or if it just isn't lined up properly, because then the scapula wings, and as we discussed earlier, shoulders are very important for bodybuilders, as are
very important. Yes, and it also starts leading to a lot of other issues that doctors don't want to recognize either. I had a gentleman come in. He's one of my what I consider here at our office we call general population, since he's not an athlete. Just likes working out. He's a fairly built individual. Again, subscap restriction. But it had moved on to other things to where it was causing his first and second rib to constantly be out of place. He had 3 MRIs. He'd been to 2 different specialists. The only thing they were focusing on was the shoulder because, of course, with the first and second rib out of place, he was feeling the pain in the shoulder. So after going through, it was funny. All we did was release the subscapula. He got up, went to move on the table, and the way he used his elbow to push off the table, you actually heard his rib pop. And as soon as and all of a sudden he took a big deep breath. He turned and looked, and he goes, "Justin, that was the first time in 3 months that I've taken a deep breath without a sharp pain." And so again, it's just one of those things that a lot of people are overlooking. We see it a lot in bodybuilding because of the positions that they're having to put their body in. Exactly. And the photo that we have up now is a prime example. This gentleman here, again, he had been he was in the beginning stages of his prep. And as you can tell in the before photo, I mean, the amount of issues we found in his back, I don't even know where to start. That took me forever to break all that tissue up.
We're starting to
here's one where this was a gentleman had given up on training. He was hit by a car. And was basically told there's nothing you can do. You're just going to have to deal with it. He went through regular PT, but one thing that they overlooked was no one treated the soft tissue damage that he had. So we just went through. I mean, that was a lot of soft tissue trauma. He literally got hit by a car. So just by going through and starting to work the back, get everything released within the shoulders, it made a huge difference. His little bit. Oh, is it still breaking up?
So we're breaking up a little bit. I think that there might be a lag. I know that right
Hello?
now, if you can hear me, we are at the last picture. I'm going to stop the slide presentation. But I'd like to open up the floor to anybody that may have any questions. I also posted Justin's information on here, so he says you can contact him directly. We have his clinic website, rofperformance.com.
we go.
We have at RF Performance, his Instagram. Now, I don't tweet or anything like that, so I can't help you there. But also his email is rofperformance.com, and you can reach out to him directly. He has some really, really great information. I know with these shorter webinars, it's hard to cover everything. I'd love to get into lumbar erector myofasciitis. I'd love to get more into demonstrations and treatments, but we're kind of at the mercy of the internet connection and the webinar. So first off, I want to say, thank you, but let's open up the floor. I'll give it a few seconds. Justin, if you can hear me, I'm going to give it a few seconds for some questions, and then yeah. Okay. What is your favorite technique for bicipital tendinitis, as we commonly see that occur in upper cross syndrome?
Perfect. Ooh. Favorite technique with a bow and just a regular strum. Just taking that tool right along the head of that bicep, and then also I make them go into active scraping. So anything I can do to, as I'm scraping and taking them through a natural range, to get them to go along with that. Hopefully everyone got to hear that through the lag.
I know. I'm so sorry. I'm so happy that all of you guys have joined us, though. And, if you have any questions in regards to the bodybuilding population, he's really a plethora of knowledge. He's worked with some really great people, including CrossFitters, including some very innovative thinkers in the athletic field, especially in terms of bodybuilding, powerlifting, and that type of patient population. And I would love to get into more details and whatnot, but I'm very afraid of losing visual or audio completely. So I really thank you guys all for being here, and I highly suggest reaching out to Justin in regards to any kind of clinical questions. And of course, I'm here as well if you ever need any kind of insight on maybe speaking to somebody who has a specialty, or someone that you'd like to see on here for a Q&A. Please feel free to reach out, and we're here to help. Also, we do have a special going on right now for the HG Pro, and I just posted it in here on the chat, and I highly recommend checking that out, because I believe it expires at the end of the week, in which we're pretty much there already. So the HG Pro is something that Justin said he uses a lot in his clinic, and I took it on my honeymoon. So it is definitely versatile and good for travel and any kind of athlete. It also is a little bit sharper, as we were talking about before, and he was talking about his athletes having, very little cushioning in between the skin and the muscle. And so having a little bit of a sharper tool to get those finite spaces is very useful. And that HG Pro is a little bit sharper in the bevel. Justin, I'm going to open up the floor. I know that there's a lag, but do you have any kind of parting words that you have to offer in terms of maybe one or two clinical sentences in regards to the bodybuilding populations and considerations for our listeners?
Yes. Yeah, always with the body patient, the thing that I have found to be the most important is, remember, these athletes are training every angle of their muscle, so make sure that you treat every angle of the muscle as well. That's very important. It was one of the mistakes I made when I first got into it, was I was just looking at the muscle as a whole instead of breaking it down.
I think that's really good advice, and that's actually something
That's
that
the biggest thing I can tell everyone is just look at every angle. Yeah. And I just sent you a text because I didn't know if you could hear me. That way, to see if everyone everyone would be interested in, once we finally get the connection figured out and adjusted to where we don't have this problem, about me possibly seeing if I could bring one of my bodybuilding patients on and maybe do an actual demonstration of some of the stuff that I do with bodybuilding clientele.
we have, I mean, I know at least I want to see this, but we do have, yes, we have people interested. So you and I can talk about that, Justin, and everybody stay tuned. I would love to have Justin back on here, and, you know, I think live treatments are definitely worth the while. But if you have, again, if you have any clinical questions, please feel free to reach out to myself or Justin. I put his email on here personally. He has some special for you too, and some special information. So please make sure to reach out to him after the webinar, and stay tuned for the future. All right. Thank you, guys. Thank you so much for coming. Enjoy your weekend. I hope everybody had a wonderful holiday week, and we'll see you again next week.